For an expanded chat on the global outbreak of coronavirus, we are now being joined by Dr. Olakunle Irojah, a respiratory physician, and Dr. Sylvia Cole, an ANAESTHETIST and intensive care physician. Welcome to the program. Good morning.
Good morning. Thank you for joining us.
Thank you very much. Well, let's start with Nigeria here. The Nigerian government has been trying to deal with the challenge, and various state governments, particularly the Lagos state government, have also been making efforts. What's your assessment of, the response from Nigeria, considering that Nigeria is listed as one of those vulnerable countries in terms of capacity to respond in the event of an emergency? Let me start with you, Dr. Irojah.
Yeah, thank you very much. The Nigerian government, they've started making significant efforts. Lagos State, Nigerian government, the parastatal that's in charge of this particular outbreak is the Nigerian Center for Disease Control. They've set up a coronavirus preparedness group, and so they're trying to investigate the possibilities, look into the risks, and they're still in the process of gathering information. As to how prepared we are, we still have a lot of work to do. We are very vulnerable. People are coming into the country all the time from China and from other places in the Southeast Asia, and we're not really screening them enough, I believe. So there's a lot of work to be done.
Which leads to my question. Look at the international response. The United States, New Zealand, Australia, they have banned travelers from China. Japan and South Korea have banned people coming specifically from the Hubei province. The Nigerian government has not done so, saying that they are sticking with the WHO regulations and they're not placing any travel or trade restrictions. But you now have 9,000 health workers in Hong Kong threatening to go on strike if Hong Kong does not close their border with mainland China. How do you feel as medical care professionals who are going to be on the front line if at all the coronavirus ends up in Nigeria? Do you agree with the federal government's response that we should toe the line of the WHO and not ban Chinese travelers? And do you agree that there's been enough in place with regards to screening at the airports and other measures, asking people to self-isolate if it comes to that? Are you satisfied by that?
Personally, I'm not. I'm really very scared because we're about to lose another Daredevil. The doctors out there, the doctors, nurses in the front line are vulnerable. And the patients are going to come to us from Nigeria. They're already in the country, the ones that are not infectious. The virus is not symptomatic for 3 to 14 days. So putting thermal scans at the airport only picks up symptomatic patients at the airport. Now, what happens to patients coming in from the sea? We have ships coming into Lagos from China. They have people on them. Are they being screened? I don't know. Now, personally, as a private sector doctor, what I'm particularly concerned about is now they've responded for the public sector. They've put out numbers for Lagos State for people to contact, and that is only for the public sector. Now, when they contact these numbers, the patients are going to go, I believe, to the Ebola center that was set up. Okay, that's on ground. And those patients are already in the country, will come to us privately. Now, in the private sector, we're very vulnerable. Again, I need to say, do we lose another Daredevil before everybody wakes up?
It is frightening, and a statement that came out via Ngozi Irondu, this was at a global health program at Chatham House yesterday or the day before, I believe. She said, we can be very certain that coronavirus will be exported to Africa. And to come out with a statement that is literally that brash on the point shows that, yes, we are in a vulnerable situation. Now, over the weekend, we had rumors that thankfully have been debunked by the Commissioner of Health for Lagos State, Professor Akin Abayomi, about a suspected case in a hospital in Lekki Phase 1. This put everyone on edge. Now, reading his reports, he said that people that are coming in from countries that either have infections or are vulnerable to infections are encouraged to go into self-isolation for 2 weeks. Is self-isolation the best that we can do? And what are the effects of self-isolation if really and truly at the end of the day, symptoms take 3 to 14 days before they actually show?
Now, for that, self-isolation is never really the best thing. It's a bit difficult. You're asking individual people that go to China, most of them are business people. They have their businesses, they have things that they're doing. So you tell them to come back to Nigeria and sit down in their house and for 2 weeks, not doing anything, not earning an income, not taking care of their business, it's very difficult to achieve. But it is also very necessary. Like has been mentioned, you have a situation where somebody will come back and be asymptomatic, but still contagious. So you have individuals that come into the country, they can spread the virus, and the checks at the airport wouldn't detect it. So you really do need to isolate for, at very minimum, 2 weeks. That's what has been done in the US now. Initially, they wanted to isolate people for 72 hours, but they've changed it to 2 weeks because they just might show symptoms later down the line. So we can't protect ourselves by asking people voluntarily to go into stuff. They tried it in the US. These initial people that came back, they did voluntarily isolate themselves, but it was at a base. And when somebody decided he didn't want to be isolated, they forcefully isolated the individual. So that's what we need to do. We need to keep people off the streets, off the businesses, out of contact, because you don't know who and who can possibly spread this virus.
Well, both of you are obviously not too pleased with what has been done so far by the Nigerian authorities, either at the federal level or at the state level in Lagos. But what kind of suggestions would you like to make to the government at all levels, either in terms of monitoring the ports or setting up quarantine centers or doing something about the private sector? And why is it only Lagos State that is picking up?
So I'd like to say that at this point, Lagos State has stood up and is doing what they can for the public sector. So the public sector is fine. The private sector isn't. That's why I said the private sector needs to be. And I'm going to call out a few people. I need a list out there. A few people need to come up, and in Nigeria, what we have is private people do not donate to health ventures, okay? Now I'm going to call up a few millionaires. I need them to come and donate to the health sector, the private health sector, because that's the only way that the private sector can actually deal with this, okay? Now, the government can only sort out government. In Nigeria, we have government institutions and private institutions. The money from the government goes to the government institutions, and they sort them out, and that's fine. They cannot sort out private institutions. It's not their remit. So the patients coming to us, and that's why I keep saying, patients coming to us make us vulnerable as physicians.
You want to add to that, Dr. Irojah?
To purchase what Dr. Ko just mentioned, parts of the things we need to isolate people, right? And then we need enough equipment and enough support to be able to tackle the cases that actually will eventually come. They will come because, again,
you are most certain
they will come. There's nothing stopping them from coming. So there's nothing stopping patients from individuals individuals coming to Nigeria from China. So if they are going to come, eventually we're going to have cases, and those cases will spread unless we can contain them. And people that are going to contain them are the doctors at the front line. Some will go to the private. Yes, the health practitioners. Everybody. They'll go to the government hospitals, but they also go to the private hospitals. Many more people are more likely to go to the private hospitals because they're afraid of going to the government hospital. And they may not even come out and say that they've been to China, that they've had exposure. And so we need to start treating everybody as a potential case, and we need the equipment to do that. We need the protective, personal protective equipment, masks with eye shields. We need gowns, we need all these things. And these are expensive things. The burden cannot just fall on individual private hospitals. The governments will provide for the government hospitals, but they're not going to distribute it outside the government hospital. So the private hospitals, they can't afford to buy all these expensive equipment on the off chance that they have patients. It's just not feasible.
Which is why I made a point last week of mentioning that Jack Ma of Alibaba has donated millions of dollars in his personal capacity to the fight against coronavirus. That needs to be stressed. As you were saying, we have millionaires, we have people of means here who should look into that. But I have two questions for you now. Dr. Irojah, you have accepted it, or you seem to have accepted it as some kind of fait accompli, that these people will come here. Is there no sort of mechanism for stakeholders like yourself to give your view to the federal government, well, particularly the Ministry of Health and also the Immigration Service, suggesting that you don't feel that this WHO regulations should hold sway in Nigeria? Because I recall with the Ebola crisis, Chinese restaurants, Chinese hotels refused to allow Nigerians when there was the Ebola crisis. So why are we flinging our doors wide open? Is there no mechanism for your voices and your concerns to be heard? Or once this directive has come from the Ministry of Health, that's it?
Okay. Now, the various bodies in Nigeria that are related are making recommendations, and we make recommendations through some of these bodies. Like, I belong to the Nigerian Thoracic Society, so they have made some recommendations to the government, and we are going to continue putting pressure on the government that we can't just sit back and hope for the best. We do that a lot, but we can't continue doing that. We can't just hope for the best that, God forbid,
it's not a matter that can be addressed through prayers.
No,
Yes.
Unfortunately, it's not a God forbid situation.
Yeah, it's a practical issue.
It's a real situation, and they are here already.
But I
That
now
is
wanted to
my
ask
view.
you, Dr. Cole, we have heard reports in China that some patients are cured and discharged. What are those treatments that they received, and are we prepared for that in Nigeria?
Now, the virus does not necessarily become severe. Everybody doesn't have to have the severe case. So some people have a mild case and get better. Some people get the severe case. Now, the only way we are going to know if they have the virus at all is if we test to find out if they have the virus. There are test kits out there, okay? Now, the test kits are available to the public hospitals right now. So what we're saying is that they're not available in the private.
And that's really sad. We're about to go on a very quick commercial break, and when we are back, the conversation continues. Do stay with us. Welcome back to the morning show here on Arise News. Dr. Olakunle Irojah, a respiratory physician, and Dr. Sylvia Cole, an anesthetist and intensive care physician, are both here with us on the morning show today discussing coronavirus and the risks for Nigeria. Now, you've both basically said that it is already here, and regardless, you've agreed with the point that I initially put out by Mrs. Ngozi Erondu that we can be very certain that coronavirus will come to Africa, which is scary. So now, Dr. Cole, I'd like to ask you about prevention steps when it comes to the general public who are all really scared right now, as we should be. What steps can we take to prevent and ensure that we're putting ourselves in the safest position?
Now, it's simple. For the general public, what you need to do is wash your hands, use alcohol gel regularly, and make sure when you touch surfaces that are generally touched by everybody, you use alcohol gel after. And
Alcohol gel, that's the one they call sanitizer.
Sanitize. Tissue and not at anybody. Okay. Now, so for those that have a cough already, and I'm talking about those that have come back from abroad now, they need to have one of those two masks on the screen now. On the left, the general public needs the masks. And if you come into hospital, we can show you how to wear them, okay, just to protect yourself. Physicians need the mask on the right, which is quite scary.
It looks like something I've seen in so many crime movies.
Yeah, it looks like a gas mask, but it actually is. And there are two filters at the end that help us, because when we're actually looking into the airway, we are very vulnerable. So we are the ones that are in the front line, so they need that mask. So that mask needs to be provided for physicians, both in the public and private sector.
Wow.
Well, two quick things. One, the coronavirus has also been politicized. Some people have protested that people are using this to blackmail China, whereas it's just a human problem that could happen anywhere. I know some Nigerians who will not go near any Chinese restaurant at this moment, okay? But, China says this is a case of racism, and a lot of the Chinese object to it being labeled China virus. So do you think that, it's been politicized, or it's just something that we should focus on the public health dimension of it?
If I were Chinese, I would feel very, at this point, yeah. Because China is ground zero. They're doing what they can do for their populace, and they're building 2 big hospitals rapidly over 2 weeks. Now, right now, WHO numbers, we don't have any hotspots in Africa, none at all. Dr. Irojah heard of a case
in the Ivory Coast.
So, but it wasn't confirmed, so luckily that's fine.
Another case in Ethiopia, another one in Botswana.
Kenya, there's also a suspected case.
All of them are suspected, and it's a bit difficult.
The only thing is that you cannot confirm until you have a confirmed test. So in as much as somebody has a symptom, so everybody has a cough or whatever, they don't have coronavirus. So if calling it the Chinese virus is wrong, it's very upsetting. If I was Chinese, I would be upset that you are calling it a virus over my country. If it's the same way when we had a problem in South Africa and you say it's Nigerian, the other way around. So don't call us names as Chinese, I'm saying. And what you do is protect your country. So Nigeria needs to protect its borders. And they need to protect land, sea, air, road. They need to, everybody that comes in through these routes need to be quarantined. Anybody that's coming in from Wuhan needs to be quarantined for at least 2 weeks before they are released to the public. The only way we can do that is if the government takes a stand and quarantines these people. Asking people to self-quarantine never works. It didn't work with Ebola. It wouldn't work now. I need to call out a few millionaires. Please put their list on the screen.
I love it.
Thank
love
you.
it.
So that they can be
save our souls appeal, right?
Yes. They should put their
Who
money
are these
to good
millionaires? You know their names?
I do.
Yes,
Please,
you
can
can
put
mention them.
Okay, you have a list that already exists.
Yes, if you could just start by mentioning the
mention
names
them,
while we wait for the list
Okay.
to be on the screen.
Aliko Dangote, Femi Otedola, Tonyeko, Ade Odunsi, Tope Shonubi, Mofe Boyo. Who else?
You
Yes.
seem to know all
Follow
them.
Alakija.
Yes.
Help me.
They are not
Now,
doing badly.
what I want them to do, and really, I want to mention 25 millionaires, and I want them to go to their community and help the private sector. I'm not asking them to go to a particular hospital or a particular place. The government is doing what they can for public sector. I want the millionaires in this country to do what they can for private sector. Find out the people who need help in your community.
Except that you are focusing on billionaires. If we were talking about
Millionaires, billionaires, really,
the
at
person
this
to
point,
my right, would also have to do something.
at this point, nothing is too
Nothing
little.
is too small. You have to remember that, this is a public health concern for everybody. And the virus, if it's any case in Nigeria, it's a case everywhere in Nigeria because every individual can spread it. Any individual case can spread it. We don't have all the information about this virus yet. In fact, there's a lot that's still not known about it. We don't know how fast it spread. The mortality rate that we have is not even very clear. We have a mortality rate of maybe 2.1% or so. But that is unclear because we haven't gotten to the end of this outbreak. So when we get towards the end of this outbreak, they call it a pandemic now because it's everywhere. By the time we get to the end, we'll now be able to see how bad this virus really is. So before it gets there, let's stop it from spreading. Let us protect ourselves. And it's a public effort. It's not an individual effort. If we're calling billionaires, it doesn't stop at
the
them.
multimillionaires,
Yes.
and the millionaires, and the thousandaires.
Yes.
Anyone that can genuinely offer help
Correct.
should help.
Yeah,
honestly.
it's better to phrase it like that.
Yes.
That's an important call. But who are the particularly vulnerable people with regards to this virus? Because I keep trying to stress the fact that it's not always fatal. This is me trying to be hopeful.
You're
but
being
who
very
is...
hopeful, and I'm happy that you're being hopeful because it's not everybody that is going to get the severe case of coronavirus. Some people are. Now, when those people get the case, where are they going to go? Air ambulance, right? And they're going to be flown where? Abroad. That's why I'm calling the millionaires. Because they're going to fly their people out. Now, what are you and I going to do? We are going to go to the private hospitals.
Mm-hmm. Can I ask a question regarding recurrence? With Ebola virus, that virus, once infected, you cannot be reinfected. Is that the same with coronavirus?
We do not have enough
This is
information.
the scary thing about it.
The thing about it
It's a new strain with this one, isn't it, as well?
Now, this is a new...
It's called novel coronavirus.
It's a new strain.
Which means that, we've had coronavirus
We have.
before
Yes.
now.
Yes.
So what's the status of scientific research towards getting the vaccine?
Okay, so now a lot of effort is being put in that. Everybody is making efforts. The United States government, private companies, Johnson & Johnson, I think they have a HIV treatment which they're testing on the current because of some similarities that they share. It's an antiviral agent, so they're trying. Then there's another company, Regeneron also. They're generating a vaccine. The Chinese government is trying to to manufacture a vaccine. But typically, vaccine production takes time. We're talking of 8 months to a year to generate a new vaccine. This is a new disease. We had coronaviruses in the past, like SARS and the Middle Eastern Respiratory Infection. So they took a while for everything to settle down, and they were all very bad infections in their time. So this one, we're just seeing the very beginning of it. It hasn't even peaked, so we don't even know how bad it is. It's just at the beginning stages. We don't know, like you asked, once you get it, do you have immunity? Or you get it, you go home, maybe your wife has it, she'll give you back, and then you keep on passing back and forth. We don't know. We can't see.
I hope it doesn't get as bad as the situation in Contagion, which is a film focusing on a virus outbreak.
Those are things that help us to be aware. The films, they can be scary, but at least they keep these things in the public awareness that we need to be careful. So all the things that Dr. Cole mentioned about public protection, if you want to sneeze, cover your nose with your elbow, not with your hand, because that's you shake people and whatnot. If you use a tissue
Maybe we should even stop shaking hands.
Yeah.
At the point during the Ebola
Wash your hands and
outbreak,
keep
they
them to
said
yourself.
Don't shake hands.
Yeah.
In fact, it's even good advice because even in Nigeria, this is like flu season, even in Nigeria. So it's even good advice generally. We limit contact as much. But if you're sick, limit contact. Just if you're sick, don't...
Hold your thoughts for just a minute. We'll go on a very quick commercial break again, and then we'll bring this back up when we return. Do stay with us. Back to the morning show here on Arise News. Still on the topic of coronavirus, we have Dr. Olakunle Irojah and Dr. Sylvia Cole with us in the studio. Thanks for staying with us, of course. Before we went on a break, you were making a point, which I'd like you to conclude on. And then afterwards, Dr. Cole, I'd like us to also discuss the outbreak of Lassa fever that we currently have across several states in the country. I believe there was another confirmed death in Kaduna State yesterday and in Delta State today, with about 8 new cases as well today. So we're in a situation where we have another outbreak that we have to also speak about. But Dr. Irojah, I'll start with you first.
Okay, thank you very much. Just to conclude, it's important to mention that we have to not panic. Remember that this is a disease that ranges from mild to severe. The severe cases, fortunately, are few, but you can never tell who will have a severe case. More likely in patients that are vulnerable, people that have immune suppressive conditions like diabetes or other conditions, cancer and so on, they are more vulnerable. But anybody can come down with a severe form. So while people shouldn't panic, people should have to be very aware of protection. Keep yourself safe, wash hands religiously. In fact, you can wash your hands obsessively. It's not too much. Try to, if you want to sneeze into a handkerchief and throw it away immediately, or sneeze into your elbow. Keep clean, stay away from pets as much as possible. Even in large gatherings, if it's not absolutely necessary, perhaps you can stay away from them for now.
And I think we should also avoid kissing people, right?
I will refrain from making comments about that.
And Dr. Cole, over to the situation on Lassa fever, which is, of course, another issue.
So Lassa fever is transmitted through rats. And here, the problem we have in Nigeria is with food that is exposed. So what we want to do is advise people to avoid eating exposed food. So things like gari that you drink. It's very important that gari is not, at this point that we don't know where Lassa fever is, we would like to tell people to avoid drinking gari and prefer them to have eba instead. Nice.
Well, whether it's flu or any other ailment, you know, one of the biggest problems we have in Nigeria is this belief in religion and spirituality. And you made a point earlier on that, you know, coronavirus is not a God forbid matter. Yeah, but I think maybe you would like to help us, you know, develop that further, because before you know it now, you know, you have the churches talking about witchcraft. You have some prophets saying that they had predicted that there will be this kind of situation, and it's the work of the demon and all kinds of, you know, because our people are very vulnerable, you know, in terms of their spiritual beliefs. And that's not just in Nigeria, across Africa.
To add to your point, Dr. Abati, how did Ebola come to Nigeria? That man was looking for a cure. He was looking for someone to pray for him, and he came to Nigeria. So that's a really good point. Yeah.
So, I mean, what's your reaction to this? You know?
So I would say at this point that I would advise churches not to go out and say they can cure either coronavirus or Lassa fever, because they can't. They can't cure any of these.
Holy water cannot do it?
No, sir.
Anointing?
Unfortunately, anointing oil cannot cure it. No.
Unfortunately.
Yes.
I mean,
that is the situation as is. It is a virus that spans a number of days, and what we have is retrovirus drugs to kill the virus, okay? We do not have anointing oil. Is olive oil that has been prayed on. Yes, that is what it is. Olive oil that has been prayed on. Now, olive oil does not cure viruses, unfortunately. Thank you. Holy water does not cure viruses. You need to wash your hands with the holy water and soap first before it can help. Yes.
Can you just hear the illusions being shattered all across the country? So I want to talk to you about hand washing. There's a belief that it has to be antibacterial hand wash, but really, apparently it doesn't. Just ordinary soap and water will do.
Just the job.
So there's no need to go and start looking for antibacterial.
But you need to have sanitizers. Everybody needs to have a sanitizer, because when your hands are not visibly dirty, then you can use a hand sanitizer, which is alcohol-based. Okay? So it's not every time that you can get to a place that you have water and soap to wash your hands. So I would advise everybody to personally carry a hand sanitizer, which is alcohol-based, any brand.
And that does not mean people should drink alcohol.
No, please. Alcohol.
Please. Because our people.
No, we need to alcohol drink. And you know, the thing about it is that when Ebola came as well, there was this myth that dipping people in salt, cooking them. Yes.
I missed that one.
I honestly missed that one.
Because many of our people, when they
believe that
alcohol, they say, why should I wash hands with alcohol? It's better to
drink it. So
it's not.
So alcohol is not the answer. I'm talking about hand sanitizers that are alcohol-based, not drinking alcohol. Drinking alcohol will not cure this virus.
Thank you for the clarification. And can I go back to a point we started off with as well, talking about the test kits, etc., and basically the material that is needed to tackle the potential of coronavirus spreading across the country. How much are these test kits, just to give us an idea? And then if the private sector were to come together to help out with private hospitals, how would you suggest that the private sector goes about this, or the millionaires and billionaires, shall we say? Is it through a fund? Is it through them personally targeting hospitals that they know? What is the best structure and strategy now that we're already in a vulnerable situation?
I believe at this point, the best way to go about it is to go to people who already have foundations on ground, okay? It's not throwing money at hospitals. You know, hospitals don't just need the money. So what we do, if you go on different sites that have, people that have foundation sites, they're out there, you donate money to the sites, and they will now purchase PPEs and equipment for the hospitals. That's the best way I think we can go about it at this point, because those foundations, the NGOs, they're already in place. Yeah. We have a couple of them in the country, and all you have to do is Google them. You'll find them. And what I advise is people should go out to their communities and help their different communities, because in Nigeria, we're looking at the federal situation, which is being tackled by the federal government, the state situation, which is being tackled by the state government, and now the local government situation. Now, so anybody can donate to all these measures. So you can still donate to the federal government. They need help. I think they're overwhelmed.
Well, let me ask you a general question. I mean, many Nigerians are concerned about the health sector in Nigeria. And government is always saying Nigerians should not go abroad to seek medical care, that the government is providing enough for Nigerians here, and that we even have more than enough doctors. One minister said the other day that any Nigerian doctor that wants to go anywhere in the world is free to live. As people who are in that sector, you know, what's your assessment? Do you really think that government is serious about strengthening the health sector beyond state governors just building, you know, gigantic hospitals that have no equipment?
And I take this personally. Now, I'm taking this because I'm a doctor that trained in University of Hospital Louth. Then I went abroad and I got more training, and then I came back. So there's nothing wrong with doctors going abroad and getting training, okay? Now, sometimes we need to go for monthly training, yearly training. Sometimes it's 5 years. We go, we get more, we get more training, and we come back. Now, I think what the government has a problem with is those that go and do not come back, because then we lose. It's called the brain drain. Because what happens is the medical students, the medical teaching hospitals in this country train medical students, and they train us for very cheap, and the government pays for our training. Then we go abroad and we earn money, and then if we don't come back and give back to our society, then what has happened is that Nigeria has lost out. Now, there might be situations where the government says you can go, fair enough. Then what will happen is all the doctors will go, and then what happens to the populace? Not very good. So as you said, it's very sad when a minister says you can go. Because for all of us that are still here, he's just saying, we don't need you, you can go. And it's sad for us that are here, because it's like, what do you mean? We are here, we're working for you, and you don't want us.
To add to that, we actually do not have enough doctors in the country. Full stop. No.
What's the ratio?
Right now, Nigeria has very poor statistics, but I think it's 1 to 40,000 or something ridiculous like
and
that.
1 to 40,000?
Now, the thing about it is that the ratio is different in the cities and in the village. In the village, we actually do not even sometimes have any doctor. Sometimes in the village, all you have are nurses, midwives, and healthcare assistants.
Yes.
So our doctors are concentrated in the cities, and that's because that is where they get the better pay. Now, you send a doctor to the village after being trained for so long, and then you say to him, I'm not going to pay you the money. Frankly, what's going to happen? He's going to be like Joe. He's going to carry his bags and leave the country. Yeah. And then you say to them, become a farmer. It's fine.
Yeah, or a fashion designer. What was that?
Fashion designer after your whole
styling work.
Yes.
So.
And if this is the picture, so should coronavirus get to the rural areas, we will have a very serious crisis on our hands.
Oh, certainly.
So we don't want coronavirus to get to the rural areas. Because what happens in the rural areas is that people do not even go to hospital. They go to traditional healers and the churches. Traditional healers, as I've said, the churches do not have a cure, unfortunately. The traditional healers do not have a cure, unfortunately. So that is what will happen. They will go to traditional healers and the churches, and they will die.
Oh, no.
Oh, no.
That's just the stark reality.
It is. So I don't want to scare anybody. It's a scary situation, but what I need to say is that everybody does not get to severe states. So some people get the mild disease, some people get the mid-term disease, and some people get the severe disease. It's only the people who get the severe disease that have death as an endpoint.
And this
Dr. Irojah, before we go, what do you think government should do in specific terms to raise the level of the health sector in Nigeria? Beyond funding, I mean, I know all of us will say pumping more money, but is there something else that can be done?
Well, yes, I believe that there's a lot that can be done, and just a few suggestions. I mean, she mentioned the fact of people doctors need training, going abroad and coming back. There are ways to encourage doctors to come back to Nigeria, which is important. We need doctors that have gone abroad, that have learned all the latest techniques, have all the latest information, have access to equipment and other resources. And we need them to come back to Nigeria and give back. So we need the government to actually encourage people to come back. We need the government to even be at the forefront of sending doctors abroad for training with the intention of coming back. And then you provide, money is fine, money is necessary, but it's beyond money. People want to be safe. People want to be respected. People want to feel like they are useful, that they are appreciated. Countries like Cuba, the doctors are not the most highly paid in the world, but they're very dedicated because the country makes them feel like they are important. So you send your doctors abroad, because we need that. We need people to learn more. We can't be isolated. The whole world, everybody goes around. We need people to go and come back, bring their skills back, bring their knowledge back, bring their care back. And more doctors have to come back. So we need the government to encourage people, send them abroad. People should go abroad and let them come back.
Because 1 to 40,000 is a very scary ratio to actually hear this morning. I did not realize that it was that big a gap. That is really scary.
1 to 40,000.
And this particular strain of coronavirus, just to confirm, comes from snakes, I believe. Did other strains of coronavirus also come from the snake or different animals?
Now, for this particular one, again, it's a proviso. It's suspected that it comes from snakes because they did some sequencing and they found that the most similar virus was seen in snakes. The most similar virus to the one that we have now is novel coronavirus. It was most similar to a virus found in snakes. In SARS and I think MERS, there was bats. So essentially, likely a virus that has been running around all these animals, mutated to be able to affect human beings, or humans were unnecessarily close to these animals. Either they ate them and the mutated strain was able to gain access.
Thank you, Dr.
Thank you so
Irojah.
much.
Thank you, Dr.
Thank you,
Cole.
Thank you very much.
Thank you very much for